Hey, sorry. A lot of people actually think that as chiropractors, we are bending, twisting, cracking bones, and that's what we do. But in fact, we are not bone setters, and we certainly aren't here to crack your bones or fracture you or hurt the body. That's for sure. I'm Dr. Vikas Puri, as you know, president and co-founder of Intelligent Health Group. One of the things always from the beginning of my 20 years of practice has always been about teaching people exactly what it is that chiropractic does. Because there's a lot of myths out there. There's a lot of misunderstandings as well. Many people, even today, when we were out at an outreach in the community, people were saying, I'm scared of chiropractic. I hear they crack your bones. Or it's very painful and things like that. So let's talk about some of these things openly, and try and relieve a lot of people of a lot of tension or stress at the thought of coming and seeing a chiropractor. So what is a chiropractor? As a chiropractor, we're doctors. We are here to make sure we diagnose exactly where you are on the health spectrum. How is your body actually functioning? And that just doesn't mean just your back or your neck. That means overall your well-being. How is your mindset? How is your emotional stressors in your body and in your life? What is your physical stress on your body right now? How is your body generally in terms of posture, in terms of tension, in terms of how it's moving? And then of course we talk about chemical stress. How's your diet? How's your nutrition? How's that affecting your health overall? We look at all of this globally because we understand as chiropractors that chemical stress, physical stress, and emotional stress are the three things that are mainly playing on the body every single day. And we have to help you change the way those things are coming into your body so that you actually get a better response with your health. So we know that the nervous system is the master control system of the body. That's your brain and spine. It controls and regulates every cell of the body. So if that's not working right, you can't work right. It's the power. It's like the circuit board in the house. You have your spine, and all these nerves come and exit, and they go plug into different organs of the body. So if that is not working properly, or there's less nerve flow from the spine to the body, you're not going to function at your best. And so the things that make the spine go out of alignment or our posture go improper is when we go into a fight and flight response due to stress. And again, circling back, I mean physical stress, chemical, or emotional. All of those will create the same reaction in the body. Cortisol, a stress hormone, will go up, your muscles will react, and your posture will shift and change. And if gone uncorrected over time, your body can set in a misaligned position, and you can constantly be programming yourself to live at the mercy of stress in that reactive mode, in that fight and flight mode. And you can get chronic issues happening, like chronic inflammation, diarrhea, upset stomach, sleep disorders, mood disorders, and a whole host of issues can start developing. Weight loss issues can develop where you're not able to help metabolize yourself because you have higher levels of stress, so your body's not in a position to be metabolizing properly. So literally, the spectrum is endless of what stress can cause. But again, it starts by not understanding that we have to make sure that we release tension on the spine, improve posture, because our structure affects our function. The straighter the spine, the better aligned it is with the right curves and so forth, less stress on our nerves, and less stress hormone, and better health overall. So that already starts to change a little bit of the myths around chiropractic, that we're just there to move a bone, or we're there just to, get rid of a back pain or a neck pain. Chiropractic really is for overall health and wellness. Everybody, we say from womb to tomb, should see a chiropractor, because if you have a spine, it needs to be functioning at its best. You go to a dentist to keep your teeth clean, you should do the same thing with your spine. It literally controls everything. Having a healthy spine, properly functioning spine, properly aligned spine will help every aspect of your being. So important, especially nowadays with so much stressors around us. We know the mess is coming in. We got to clean up the physical body so that we're processing those stresses and tensions through the body. They're not manifesting as illnesses in our physical frame, and hence also into our mental, emotional frame as well. So Does chiropractic always have to involve using manual manipulation or cracking of the spine to make the adjustments where we actually correct that alignment of the spine? And so what that means is when stress is there, the bones can sometimes shift out of alignment a bit, the joints can lock, and then there's more inflammation in the joints, which will then cause more stress on the nerves. So to relieve that, we do adjustments. So when we do adjustments, many people, traditionally, manual manipulation is done where you grab that vertebra and you just help unlock it by creating a very quick thrust into that joint manually. And then what happens is when that joint opens up, gas is released from the joint. That's carbon dioxide. So that's that sound that comes, the popping sound that happens after you get a manual adjustment done to an area of the spine. So you're not cracking anything, you're just releasing tension. You're releasing gas from the joint capsule. So that already hopefully makes you understand what's happening. It doesn't have to be painful at all. It can be very, very relaxing. But we don't have to always use manual means. We have instruments as well, activators, arthrostim devices, and many other tools where we can use instruments to help get the joints unlocked and get them moving. Luckily now with science, there's so much technology out there. So with those tools, there's no cracking at all. There's no popping sound, there's no sound at all from the joint because we're not moving or gapping that joint to that degree. So you're getting the motion just enough to get the joint unlocked, not too much, not too little. It's calibrated just right, and that's very, very gentle. We can use it on babies, on frail seniors, without any issues. You won't even know sometimes anything's happening as we're doing those techniques. So the great thing about chiropractic is there's about 60 different chiropractic techniques out there. Some are very, very gentle, and some can be more involved. It just depends on you, your preferences, your condition, and what the chiropractor sees fit. And we're all trained in different specializations as well, so we may have a certain method or protocol that we might specifically present you with. And ultimately, it's about the results and about getting that same end goal, which is a better functioning nervous system, better movement in the spinal joints, everything moving properly, so that ultimately better nerve flow to the body. That's the end result of any chiropractic technique. Different means, but the same result. The other thing that people say is when I go to a chiropractor, then do I always have to go to a chiropractor? Again, I find that to be a bit humorous. Nobody's forcing you to go to a chiropractor again, but when you know what it feels like to feel well, to feel properly mobile, to again have all your senses about you, to be able to sleep better, digest better,